Genetic screening tests are offered by the NHS to all pregnant women in England, Scotland and Wales. They can tell you the chance or likelihood of your baby having a genetic condition, but do not give a definite yes/no answer. All women are offered screening tests for Down syndrome, Edwards syndrome and Patau syndromes. The tests involve taking blood samples and ultrasound scans. The NHS offers these tests to all women, and it is your choice to have them or not. A more recent development in antenatal screening for Down syndrome, Edwards syndrome and Patau syndrome is commonly known as non-invasive prenatal testing, or NIPT. NIPT requires a blood test from the mother. Cell-free DNA material that comes from the placenta is then extracted from the blood sample and analysed to check for extra genetic material associated with chromosomes 21, 18 and 13, which can indicate Down syndrome, Edwards syndrome and Patau syndrome, respectively. The test can be performed from the 10th week of pregnancy, and results for NIPT usually take between a week to 10 days. If the result is reported as low chance, it is extremely unlikely that the baby has the condition. If the result given is high chance, or sometimes given as a greater than 9 in 10 chance, you will be offered a diagnostic test such as a CVS or amniocentesis to give a definite answer. A result from NIPT suggesting a baby has Down syndrome is most often likely to be right, as it is an accurate screening test. But because it is screening, sometimes the prediction is wrong. NIPT is not as reliable for Edwards and Patau syndromes. Sometimes NIPT does not give a clear result. This could be for a number of reasons. Perhaps they could not collect enough DNA material from the blood sample, or there was a problem in the laboratory. A second test is always offered. If the second test does not give a result, it is important to seek advice from an expert healthcare professional about the next steps. Not all hospitals offer NIPT. It is widely available in the private sector, where it costs from £350 to £500. If you decide to pay privately for NIPT, make sure you research the clinic providing the testing. Ultrasound scans can show images of a baby's body inside and outside. Although a scan cannot show genetic changes, it can show physical features in the baby that might suggest a genetic condition. Often it will be unexpected scan findings that lead to the offer of invasive diagnostic procedures, called CVS or amniocentesis, to check if a genetic change explains the findings. Some physical conditions, such as spina bifida or heart defects, can be diagnosed through ultrasound scans.